Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
hematological manifestations of chronic renal failure. In chronic renal failure, first most common manifestation is anemia. In anemia, there is relative deficiency of erythropoietin is seen in the patients with diminished red blood cell survival is seen, and there is also bleeding diastasis are common in these patients. And the patients can have iron deficiency, and there can be hyperparathyroidism can occur, or bone marrow fibrosis can occur in the patients. So because of hyperthyroidism and bone marrow fibrosis, if there is bone marrow fibrosis, the blood cells are formed from the bone marrow. So because of fibrosis in the bone marrow, the patient will develop anemia. Second, whenever there is bleeding diastasis, the patient will have increased blood loss from the body. So because of the blood loss and bleeding diastasis, the patient develops anemia. Then iron deficiency, obviously because of iron deficiency there will be anemia. Whenever there is decreased RBC survival will result in increased anemia will occur. Decreased RBC survival will be there. Whenever there is decreased RBC survival, this will cause easy destruction of RBC resulting in anemia. Then there can be deficiency of folate or vitamin B12 deficiency can also cause anemia. So these are the different causes of anemia in chronic renal failure. Then, so the other hematological manifestations are, if you see the regarding platelets. In regarding platelets, we will see that there is mild thrombocytopenia is seen in chronic renal failure. There can be platelet function abnormalities are common in the chronic renal failure, and there will be prolonged bleeding time is seen in the patients with platelet disorders, and there will be lower platelet factor 3 activity is also seen in these patients. So these are the abnormalities of platelets. Then abnormalities of leukocytes. In the leukocytes on the peripheral blood smear, if you do a peripheral blood smear, you will see that there is presence of Burr cells are seen on the peripheral blood smear, with hypersegmentation of neutrophils are also seen. There are peripheral Burr cells are seen with hypersegmentation of neutrophils are seen in the patients. Then one more important thing in the platelets is, in chronic renal failure, the platelets do not release the granules. Because they do not release the granules, so the granules are not released, so as a result the clotting will not occur, so the patient will have bleeding tendency, and this is one of the reason for development of prolonged bleeding time. Then in the leukocytes there is hypersegmentation of neutrophils, and the neutrophils will do not release the granules. The neutrophils do not release the granules, and thus these patients are actually more prone to infection. Then if there is any bleeding in the patients, if there is any bleeding tendency, if there is bleeding, then we should give a drug. So for bleeding tendency, we give the drug DDAVP is given, and this will increase the platelet function.
thank you and thank you for watching.